Hello. So I want to talk a little bit today about the impact of health inequalities, and really to reduce health inequalities we've got to tackle the most modifiable factors that we have, and there's no bigger one than tobacco. So that has been a really big focus for us, thinking about pregnancy and maternity since the summit that Fresh had back in 2008. And since the LMNS has formed, this has been a really important part for the local maternity systems across the North East and North Cumbria since 2018. So what I want to start with today is just that bigger picture, that actually there is great progression across the North East and North Cumbria. So when we set away with a real focus within maternity services in 2017-18, the smoking at time of delivery rate was 16.1%. And we managed to get that down last year to 12.3%. So it was a real great reduction, and that was based on hard work and effort and focus and working together as a system to get us to that point, which has been incredible. In 23 to 24, you can see there that we've had another quite a significant reduction down to 10%, which is amazing. And I really think that's with the incentive scheme that we've now got in place as well. That's really helping us and incentivising women and families. I don't want to celebrate too soon, but the last quarter one data that we had recently was 8.2% across the North East and North Cumbria. So what I want to do is just, if you can just take a minute, I want you to congratulate each other. It's amazing. We're closing the gap to England on this agenda, and that's down to you. As I said, there is a lot of system work, but I just really want to focus on in maternity. So what's different about maternity is that you have a bio-psychosocial model of care. So you look at women holistically, you talk about what's happening in her life, how's that pregnancy going, how does that feel, to really break down the barriers to what is stopping the quit and what's going to sustain a quit long after pregnancy ends. So you're doing this day in, day out, and that's making a huge difference to our families. So the incentive scheme, going back to that, so if we really think about health inequalities, the incentive scheme started back in November 22. We had a staged approach, and we had all 8 trusts come on board in July 23, to which we stopped and evaluated in February 24. And from that, we were able to tell that we had a high proportion of women coming from the 20% most deprived decile across the North East and North Cumbria. And of them women, 96% would come onto the scheme and make a quit attempt. The quit, it works, the scheme works, we know that, we know the evidence base shows us that. We had 39.6% women quit at 4 weeks, plus another 5% where we didn't verify the quit for whatever reason. It actually takes us to about 45%, which is much higher to what we've done in the past through traditional stop smoking services. So having this approach does work. When we look against women in the most affluent, 20%, there is more women in the most deprived deciles, and they're both set about to make the quit attempt. It's roughly around the same proportion that will attempt the quit, but when it gets to the 4-week quit, we know that it's a reduction in the most deprived decile in actually quitting, which is really interesting, because if you think that you were deprived, you would be therefore wanting the vouchers to make the quit, but there's something stopping the women from doing that. So this is really multifaceted. And that's why these holistic approaches are really important, and a continuity of carer to build up them relationships, to break down the barriers. It isn't a quick quit. It's sustaining that approach. So part of this evaluation looked at feedback from women and families as well as from staff, and we know it's evaluated really well. And what really came home on this was the approach from the staff. That holistic offer, someone who's really believing in them, that's going to support them, that's there at the end of the phone call when things aren't going right. It might not necessarily be about smoking, but it's all forming part of that picture. So if you have people that aren't here today, please feed this back. They are doing an incredible job. The incentive scheme also looked at partners, because we know that partners can come onto the scheme. It's quite fluid, actually. There's no real paperwork involved in it. We just ask that they make a quit attempt with the woman, and then they will get a voucher in the postnatal period if they blow 3 or less CO. What we found is a very small number of partners coming onto the scheme, which was quite surprising. There was only 236 partners where there was 1,687 pregnant women. So that's quite a small number. And the survey looked at this. 9.3% of partners that came onto the scheme quit. So it's a really low quit amount. And that means that we lost over 70% to follow up, which is really interesting when we know that women are 67% more likely to quit if they've got a partner or significant other coming on board with this. So that's just kind of food for thought to take back. When we've looked into insights for pregnant women, we know that this is an incredibly difficult time to quit. There might be stress with the pregnancy, they quite like smoking, they've got enjoyment, we heard that from Sue today. It's a way of relaxing, it's their thing, it takes them out of the house, away from the children. It's addiction, it's boredom. But one thing that really did come out in that insight work was the role of partners and how influential they are. And when we say partners, that is everyone around that pregnant person. We also know from the evidence that PHE produced in 2020 around the characteristics of women who continue to smoke right the way through pregnancy. So these aren't the women that have made the quit during pregnancy, it's the ones that continue. Typically, young white British women living in deprivation, might be in manual or no employment, could book late. So we've got that kind of information as a whole, and there's even more evidence when we're thinking about that around mental health, social housing, and that continuous cycle that we know children born to pregnant smokers 3 times more likely to go on to smoke themselves because it's the cultural norm. So this just really gives us the opportunity to think, yes, we know that, we're working towards that, we're making the difference, those rates are coming down, but it's about tailoring that approach and really going back to that psychosocial profile and really thinking through on an individual level, what can I do to help you? We've got some fantastic examples across the North East and North Cumbria where this is done incredibly well. It's had additional local funding to increase that contact time from the on the paper 10 minutes to much longer than that, and that is having a great effect. So what we would really like to do is to support that further, but we need to build up the evidence base. So it's a plea as well. Please document, because we know from Rachel's slides that's not right. We know it's more than that. We know 96% of the women went onto the incentive scheme, so it's much higher than what we're reporting. And I think this opportunity today is thinking about the partnerships as well. Get on board with your local authority partners. They have their own budget for the population. Well, pregnant women are part of that population, and they're only too keen generally to work with us. But we need to be really clear what we want, and we can advocate for that from a North East North Cumbria perspective. But these are individuals, and I think that's what I really want to drive home today. It's individuals in front of you, and really tailoring and addressing those local needs of the women and families. What I hope to do as the North East North Cumbria lead for pregnancy is the cocaine and cannabis use, which has been paused. I really want to drive that forward. We saw on one of those slides, you know, there's a high correlation about substance misuse and continuing to smoke. So we've got to address that, and we can address that for the North East North Cumbria. Data needs to be by middle super output area. So it's all very well, national statistics now are reported by local authority, which we've been waiting for that for probably 4 or 5 years now to come back on board, so we can at least, example Teesside, it's such a huge area, we don't know whether the difference is in Hartlepool, Stockton, Middlesbrough, Redcar, Darlington, take your pick. So that is helpful, but if we can get it by middle super output area, you can look at that and think, right, what can we do in that area? What's the cultural norm? How can we change it? How can we work in partnership? We need to do more insights for those that haven't engaged, all those women that have dropped off that incentive scheme. What happened to them? Unfortunately, we didn't have the data collection to follow them all through, but there's things that we could be looking at. And from that, you know, we've had digital approaches as well. They didn't work particularly well. I think my take home today is you can't replace relationships in front of people and staff and support. And I want everyone here to feel that they are supported in their role. So this is your opportunity. Got roundtable discussions today, breakout rooms. Get that on a piece of paper. Let's do this. Let's make the change. Thank you.